Hey dental fans, Dr. Rich here helping you learn about dentistry and teeth so that you can have a very nice smile. I had a viewer ask recently, how much does an immediate denture cost? So in this video, I will talk about how much is an immediate denture, and I'll give you an exact number as to how much it would cost at my office, not just a range, since I know people hate that and just want a straight answer. If you're watching this video, you most likely know what an immediate denture is, so I won't go over that. If you don't know what an immediate denture is, check out my What is an Immediate Denture video to learn about immediate dentures and how they are different from regular dentures. I'll leave a link to the video down in the description. Most people want to know, how much does an immediate denture cost? But the cost of the immediate denture itself is only part of it. There are a bunch of other procedures that will need to be done at the same time, and the cost of those procedures has to be included in the total cost of the overall procedure. Since what additional procedures are needed will vary a bit from person to person, I'm going to make some assumptions as to what a hypothetical patient, let's call him Joe, needs so I can give you a total price for the procedure. Joe has 10 teeth remaining in his upper jaw, and he's fairly certain that he needs an upper denture. He has his 6 remaining upper front teeth, and he's also got 1 molar and 1 premolar remaining on each side of his mouth. So the first cost involved for Joe is to come in for an exam and x-rays so that I could take a look at his teeth and mouth to see what condition they're in. At this visit, I'll also go over his health history to make sure that there are no health issues that he or I have to worry about. After talking to Joe about his teeth, he decides to get an immediate upper denture. So Joe will need to have his 10 teeth extracted. In Joe's case, I don't think he'll need an aveloplasty. An aveloplasty is trimming down of the jawbone after having teeth extracted. Some people will need to have that done, so that is an extra cost in those cases. After Joe's teeth are extracted and the immediate denture is fitted, he will have to return for adjustment visits to adjust the bite and remove sore spots as they occur while his gums are healing. I don't charge for the adjustment visits. Some offices may charge for some or all adjustment visits. Then, in about 6 months after Joe's jaw has healed and shrunk a bit, he will need to get the immediate denture reline to have a tighter fit. The reline is another cost that is included in the treatment plan. And afterwards, there will be some more adjustment visits. So Joe's total treatment plan will be an exam and x-rays, 10 extractions, an immediate upper denture, a reline of the denture in 6 months, plus any needed adjustment visits. The cost of these procedures will vary depending on where you live. It will also vary from office to office. My office is located in Westchester County, New York, about a half hour north of Manhattan, so it's in an expensive part of the USA. The initial exam and x-rays cost $270. Each extraction is $295, so for 10 teeth it's $2,950. The immediate denture is $2,250, and the reline is $400. So the total treatment cost for Joe to get an immediate upper denture is $5,870. So, if you have an immediate denture, how much did the entire treatment cost you? Let me know down in the comments. Thank you very much for watching, and see you soon.